What's the most common skin problem people has?
In most dermatology offices, you see 5, I would say, major things. Eczema, warts, suspicious lesions, so people coming in with things that they think are either cancerous or a problem, acne, and then a lot of hair issues and hair loss. I would say that most dermatologists in their day-to-day, that's the bread and butter.
A couple doctors, they use the laser to burn all that skin, the top of the skin. Is it gonna make your skin better, like build a new skin?
That's exactly what it's intended to do. Many, many years ago, this technique for fractionated laser ablation came out. So taking the lasers that you're talking about and making a bunch of very tiny little holes in the skin. These little holes are called microthermal zones. They're these small injuries. They occur in like little cones all over the skin. And what they do is they stimulate the healing in the skin all over like a big net to create new collagen, new elastic fibers, and new skin that essentially rejuvenates and resurfaces your face.
Hey guys, and today episode Beyond the Chair is gonna be with Abe, surgeon, dermatologist, doctor. So, welcome to the channel, Doc.
Happy to be here, man. Thank you for inviting me.
And with Yusuf Baidoun, one of the biggest mortgages guy. You guys know him.
Nice to be here. Nice to meet you, Dr. Abe.
Pleasure, my friend. We've already been having the stimulating conversation, so
of course.
Excited to continue.
Definitely.
For sure.
Okay, so Doc, you know, anybody like Yusuf, he like to do mortgages. I like to be a barber. You like to be a doctor, but why you choose skin doctors? What made you to do that?
Honestly, it's for me, it was quite a journey. But to start in the beginning, I was born with a congenital heart defect. So I had heart problems when I was first born. So early on in my life, I had a lot of interaction with the healthcare space, with doctors, with surgeons. And, you know, I had to have 2 life-saving surgeries early on in my life. And then after that, continued having, you know, normal visits with doctors for checkups, you know, year by year for a majority of my life. So ever since I was young, I can remember being in a healthcare setting in some way, shape, or form and interacting with doctors and nurses and surgeons. And so I think that from an early age, even though I didn't understand it, the scars on my chest and like the things that I would do and go through as like a kid that like other kids weren't going through always kind of interested me. And as I grew and got into college, in the beginning for the longest time, I thought I was gonna be a dentist because my dad is a dentist. And so it just kind of made sense. When I started going through my initial studies at Wayne State in undergrad, I got a lot more interested in just the function of the body in general. And I started doing a lot more shadowing and exploring a lot more careers. And I was really lucky to have reconnected with the surgeon who at the time was training when my surgery happened. My surgery happened in like 93, 94.
Yeah.
And there was a doctor who was the fellow at the time. His name was Henry Lane Walters III. And I found his email in the directory at Wayne State. And I emailed him and I told him, hey doc, I'm a former patient of yours. You probably don't remember me, but I would really love to come shadow you and check out, you know, like what it's all about to like do what you do.
Right.
And so he was very gracious, very generous with his time, took me under his wing for a couple weeks. And while I was in undergrad, I got to kind of experience cardiac surgery, being in the hospital, rounding, things of that nature, and see the amazing things that, you know, surgeons can do for people and doctors in general can do for people.
Yeah.
And that kind of piqued my interest into pursuing medicine. So I had my heart set on that after that experience, and then I got into medical school. And then when I entered medical school, I started exploring a lot of different things. I didn't want to have, you know, blinders on, you know, just because I had that one experience. And so I, of course, shadowed Dr. Walters. I checked out a lot of different specialties. I had a lot of friends who were interested in orthopedics and sports related fields, so I was interested in that for a while as well.
Yeah.
But when it came down to it, towards the end of my medical school career, wasn't really kind of dead set on one thing. Nothing had really kind of piqued my interest to a point where I felt like I could dedicate the rest of my life to it. And then I had a chance encounter with a friend of mine's cousin, who happened to be a dermatologist and a Mohs surgeon at the time. I remember it was like a random breakfast. Like,
yeah.
I've never had breakfast with him, I think, since to that day, but he's still a very good friend of mine. And I was telling him kind of my like troubles with choosing a specialty during med school. And he's like, man, you should check out dermatology. And I was like, I have never thought of dermatology as a field even once during, medical school. And then he started telling me about all the different things you could like do and see in dermatology. That, it's not just like, Botox and fillers, but there's surgical aspects, there are, intensive medical aspects and things like that. And I was like, okay, I'll give it a shot. And so my first experience shadowing a dermatologist was just an amazing month. I got to spend some time with Dr. Ali Moeen, who was a mentor of mine for a long time. And he basically showed me like all the different things in dermatology that you could do. In one room you go in and there's a rash and it's a puzzle and you don't know what's going on, you got to put your thinking cap on. Yeah. In the next room there's a surgery and you get to, use your hand skills to help somebody directly, and the effect is immediate and the satisfaction. And then the third room, there's artistry. You're doing something cosmetic, you're helping somebody, look a little better, feel a little better in that way. And so it combined like all of these aspects in medicine that like I really, really liked in one setting. And then in addition to that, you treat patients from all over and from all different spectrums of the age. Yeah. So you treat little kids with eczema, teenagers with acne, adults with various problems, psoriasis, hair issues, etc. And then, your older and elderly individuals with respective problems with, like skin cancer and things of that nature. And I was like, this is a very comprehensive and versatile field where you can do a lot to help lots of different people and use a lot of different skills, including an artistic eye, hand skills and talent in that regard, and then your thinking cap as a doctor and still be a diagnostician to figure out what's going on. And so I was like, well, this honestly seems like a great field. And then at the end of my rotation, I was lucky enough to shadow a Mohs surgeon at the time. And Mohs surgery is just a subspecialized dermatologist that does skin cancer surgery specifically. And once I saw that that was possible, being able to have somebody with cancer come into your office and leave that same day with the cancer fully gone in the most accurate and precise way, and be able to put them back together in a way that's aesthetic and functional, that to me was like the culmination of like what you could do in medicine, what you could provide someone. And so I was like, this is going to be it for me. And unfortunately, I decided really late in medical school, so I had to really put the hustle on. But I was very, very lucky and grateful to have good mentors and guides along the way that kind of got me, into the field. And so I matched in Richmond, Virginia, like I was telling you about earlier. I got out of my comfort zone here in Dearborn, and I went over there and had an amazing experience at VCU. And then went on to do a Mohs surgery fellowship in Indiana, in Indianapolis. And so that's how the whole thing kind of came to be.
So how long have you been practicing, since you got out of residency right now?
So since I finished fellowship, I've been out for 2.5, coming up on 3 years now.
Nice.
And I will say, probably like you as a salesman and a mortgage broker, and as you, Teef, as a barber and a professional stylist, your first couple years doing what you do are like the most amazing years.
Yes.
Because you learn so much.
Big time.
Every day, it's like an amazing experience because of, you're doing these things on your own for the first time. And though you're trained to do them and you're capable of doing them, the value you get from having the full responsibility of this is you. Yes. This is on you. There's no safety net anymore. The training wheels are off.
Yep.
Exactly. Right. Now it's time for you to put everything that you know and everything that you've practiced and trained for to the test, And in those first couple of years, it's amazing how much you grow.
Yeah.
You know, as a clinician, as a mortgage broker, as a stylist, it's tremendous.
Big time.
You know. So yeah, no, it's been an amazing ride. Whoa, look at me. Okay. Well, maybe I'll switch careers.
From
I'll
one
become an
profession
actor.
to another.
You know? Ready for the big screen. Thank you, man. This looks great. I love it.
You just remind me of that. What's the most common skin problem people has? Like you seen it every day.
You know, in most dermatology offices, you see like 5, I would say, major things. Eczema, warts, suspicious lesions, so people coming in with things that they think are either cancerous or a problem, acne, and then a lot of hair issues and hair loss. I would say that most dermatologists in their day-to-day, that's the bread and butter. Those are the things that they're kind of focused on the most, and they're going to see most commonly. Yeah.
You know, you see the skin tag?
Yeah, skin tags, see lots of those.
So how these comes? Like,
you know, it's interesting. A lot of skin tags just form what we call sporadically or spontaneously. So we don't know exactly why they come. But in some people, there are genetic reasons why they'll form. And in other people, there are like metabolic reasons why they form. So we know that skin tags are sometimes associated with metabolic syndrome or insulin resistance or people who struggle with weight. Those things can all be linked to the development of skin tags. But in some people, it's just purely genetic. And they can form anywhere. They can form under your armpits. Some people get them, you know, around their eyes. Some people get them on their shoulders and their back, around their neck. And for the most part, by and large, skin tags are totally benign and you don't need to worry about them. But sometimes they're bothersome. You're taking your shirt on and off, you know, it'll snag. You're putting your, you know, necklaces on, jewelry, shirts, and so they can become annoying. And so if that's the case, it's very, very simple to remove them. Just snipped off.
you know what's funny? I move all of them, like for my client.
You totally can.
You know what I do? How I do it?
I'm gonna hold on. Let me guess. I'm gonna guess, then you tell me. A long time ago, before I was a dermatologist, my cousin had a skin tag. Okay, and I think I was in med school at the time. And I was like, I read this thing where if you tie a piece of floss
around
their skin tag, it'll fall
String
off.
it? Yep.
And so I was like being my med school surgeon self, and I was like, yeah. And I tied a floss around it, and I was like, yeah, just it'll fall off. And then he sent me a picture like 2 days later, and his little skin tag was this like big black thing.
Oh my God.
And I was like, oh no. So what did I do?
Trial and error.
Yeah, and it eventually fell off. So like, yeah, when you cut off, so they all have a blood supply. They're called acrocordons, that's the technical name for them. And they all have this like fibrovascular stalk to them. So there's a vessel in there, and the vessel feeds the skin tag, and that's how it grows. So if you cut that off for a prolonged period of time, they fall off and go away. So you can totally do them with floss.
I do them with the thread.
Or with the thread, yeah. Like the eyebrow thread?
Yes.
Yeah.
So I just tie it.
Yeah.
2 days, fall off.
Totally reasonable.
If I see Steve grabbing some thread, I'll just call you instead.
And I'll tell you this, honestly, most dermatologists will thank you, because to sit in the office and snip tons of skin tags off people is very time consuming.
100%.
Yeah.
Very time consuming. So we thank you.
I appreciate. No, this I learned that like overseas.
Yeah, exactly. That's where I learned it.
Old school.
Yeah.
So I wanted to ask, like, being in the dermatology field itself, I wouldn't say it's undervalued for as a person like just lives their day-to-day life to go see a dermatologist just for, you know, just to go see one. Do you think that we as, you know, a collective unit between all the people should start looking to a dermatologist more whenever we might notice something on our bodies, or, you know, should we start taking more care of that? Because I feel like it was kind of a negative look to want to go see a dermatologist. You know, when I was younger, I had acne, you know, that bothered me, you know, in high school and everything, in middle school, with hormones, you know, you're going through puberty, all that stuff. It affects your confidence. It affects everything, how you look at yourself. And, you know, I wanted to see a dermatologist when I was a younger child, but, you know, there's certain things where you probably could catch something that's cancerous, or, you know, anything of that matter. How often do you think someone should check up on following up with a dermatologist when it comes to certain things on their skin?
Man, it's a beautiful question.
No, it's a great question. And honestly, our philosophy at our practice is alluding to kind of what you said. We want people to look better so they can feel better, so they can do better.
Right.
Just like what you do to people day to day in the chair,
Yes.
you know?
You look good, you feel good.
You look good, you feel good.
Yeah.
That's just how it is. Even when I used to play soccer, when I was in high school, like many, many years ago, I had a coach and he's like, we're going to get the sickest jerseys.
Yeah.
Because when you look good, you're going to play better.
Good old Deion Sanders model. You look good, you play good. Yeah.
You look good, you play good. And the same is true of life, right?
Yeah.
Like when you got a fresh haircut, you're lined up, you're ready to go, you know, you just feel better. The confidence comes. And that's what in dermatology, I think we can provide people that's very different from other aspects of medicine.
Right.
A lot of other medicine is internal, right? It's stuff that's going on kind of inside of you, you know, that is not readily apparent to most people.
Right.
In dermatology, if there's a problem, everyone knows it.
Yes.
Right. And so because of that, it's something that, you know, is very damaging to someone's self-esteem and at the same time can create a lot of issues, you know, surrounding your own confidence. And so because of that, I think that if anyone has something on their skin that they're worried about, or something that they particularly don't like, you know, about how they're looking or something like that, it's always, I think, important to give yourself the grace and the mercy to seek help.
Right.
Right? Because you never know how that small change could drastically affect your self-esteem.
Big time.
One of the things that drew me to dermatology from the very beginning was this very point. There was a patient, I still remember this guy. There was a patient that came in to Dr. Moeen's office and he had stage 4 lung cancer.
Wow.
Stage 4 lung cancer, like he was, you know, very close to the end of his life.
Oh yeah.
You know, but he had a rash that really, really bothered him. The appearance of it, how it looked, it was just like killing him.
Yeah.
He was like, Doc, I have stage 4 lung cancer. I don't care. I know I've come to terms with that. I've accepted it. But this rash is killing me. I walk around, people are looking at me like they think I'm diseased. No one wants to shake my hand.
Yeah.
You know what I mean? And the thing is, those things are so impactful because they're visual.
Yes.
Right? And being able to give people that relief in dermatology was so valuable. And one of the things that drew me to it in the first place.
Yeah.
Yeah. So to answer your question succinctly, at least if you have a problem on you, you see something changing in your skin, something doesn't look right, come see a dermatologist. You know, you never know. It could save your life.
Oh yeah.
If you wait, it's gonna be worse.
Yeah, I've heard stories where, like, you know, we were at a vacation on at a resort, and I think somebody there was a dermatologist and told a buddy of ours, like, there's this thing on your neck, you need to get this checked out, it's cancerous. And he was under the impression his whole life that this was just like a beauty mark.
Yeah.
And it was that initial comment from that person that made him go and seek a dermatologist when we got back, and he did find out it was in fact cancerous. So it's like things that as normal day to day we think is, oh, this is normal, oh, it came out of nowhere, it's not that serious. You're like, if I'm too late to go and check this out, it could be the difference of life and death almost.
100%.
So you said to this, like, is it sunscreen really important? Like if we on the beach, even if it's cloudy?
So regardless of whether there's cloud cover or not, the sun rays and the UV radiation coming off the sun is still getting through. So even though you don't feel the direct heat or rays of the sun, there's still UV damage occurring. So sunscreen is very, very important. I'm not going to say it's the most important thing when it comes to overall protecting your skin and preventing yourself from sun damage, but it's one of the foundational things that you can do to protect your skin. And the reason is most skin cancers, like squamous cell carcinoma, some basal cell carcinoma, and melanoma, if you look at them under the microscope and you do genetic studies on them, the mutations that occur in those cancers are UV mutations. So it's UV damage that's hit the cells, hit the DNA of the cells, and caused those types of mutations to occur. And sunscreen has been shown in multiple studies to reduce people's risk of squamous cell carcinoma and melanoma. And these are studies that have not just been done in the US, but in Australia as well, where they see tremendous amounts of melanoma and skin cancer For basal cell carcinoma, which is a very low risk type of skin cancer, the sun effect is not as pronounced. You can get it in areas where the sun doesn't shine sometimes. So some of that is genetic.
Right.
Yeah, but sunscreen, immensely important.
You know, I got dizzy from the sun. I went up north. I stayed 2 days, all day at the sun.
Yeah.
At night, Yusuf, I swear to God, I can't feel my bone. Like I got a high temperature, like fever.
Yeah.
It was crazy. So I asked, it was one of my friend, he's a nurse. He told me, Tiff, you got sun.
Poisoning.
Yes,
Yes.
don't go. I didn't know it hurts that bad.
So what happens when someone gets sun poisoning, right? What is your skin supposed to do to protect you every day? Number one, it protects you from the outside world physically, right? Like if you touch your skin, the outside stays outside, right? And you stay inside.
Yeah.
So that's number one, it's a physical barrier. Number two, it is a thermoregulator. So it controls temperature in your body, right? There's blood vessels all over your body and your skin. And like if you're out in the cold, right? What do you notice? Your fingers go white, your toes go white. Why? The blood vessels in your skin contract because they want to put all the blood back towards the vital organs to make sure this stuff is running normally.
Yeah.
Right?
It's crazy.
Right? And when you're in the sun, okay, all these blood vessels, they dilate. And so they make your skin get lots of blood so that you can let off the heat, right? Because your blood is hot. Your temperature is 98.6 degrees Celsius usually, right?
Yeah.
Or it's Fahrenheit. And so that is running through your skin to make you radiate heat. When you over sun yourself, right? When you get too much sun, too much heat, okay? The skin barrier that's supposed to protect you and supposed to regulate your heat, it starts breaking down. So your skin's normally like this. It's like bricks and mortar. When you burn it in the sun or you damage it with UV, the cells, they puff up, they become like balloons and they start separating. And when that happens, the barrier that protects you starts going away and you start losing a lot of moisture and water to the outside. So you get immensely dehydrated, right? And that's why it's so important to protect yourself when you're out in the sun, because the thermoregulation capacity of your skin gets compromised if you burn it too much, right? And then the third thing that your skin does that's very important is your skin is actually an immune system by itself. So a lot of people don't realize this. When your skin is functioning, doing its normal thing, there are little cells in your skin that if something gets inside, the cell will grab it and it'll be like, this is not us. I wonder what this is.
Yeah.
And it will take that to a lymph node and it will say, hey, what's this? And the lymph node will be like, I don't know, but it's not us. So let's do inflammation and swelling. So it'll send a bunch of inflammation, blood cells, neutrophils, all these different fighters that you have in your body to that area where that thing came in. So like if you get like a splinter or you get poked by something, what happens? It swells up, it turns red.
Yeah.
Because in your skin, there are those little cells, they act like little security guards. Mm-hmm. And so they make sure that the stuff that's supposed to be outside stays outside, and if something comes in, your body comes to save it.
Right.
What does the sun do when it burns your skin? It kills the security guards.
Yeah.
So people who get sun damage over time, they get more skin cancers. Why? Because those security guards normally, if there's a cell in your skin that's becoming cancerous, the security comes and says, hey, no, and he gets rid of it. The more sun damage you have over time, the more the immune system in your skin gets compromised, and the more cancers can grow without security taking care of them. So sun protection is so important. And it's not just sunscreen. So sunscreen is a foundation, big hats, wearing long sleeves, making sure that when you're out in the sun, you're in shade if you can be, making sure that if it's like 12 noon, you're not just like in the middle of the beach just getting like slapped by the sun.
That's what I did.
You know? تتذكر صفقة هوا؟
Yeah.
صفقة شمس. Like it happens.
Yeah.
You know what I mean?
You're right.
And that's what happened to you. Yeah.
And you remind me, like, you know when you do, when you get a tattoo?
Yeah.
Bro, after that, you get sick right away.
100%. Because all of this foreign stuff is coming into your body.
Yeah.
I seen a video, like,
Yeah.
all
Yeah.
your
Yeah.
white cells or the red cells,
Yeah.
they start fighting the ink.
So I have pictures in my phone. I'll show you later. So sometimes I will do Mohs surgery and I will remove tissue that is in a cancer, that is in a tattoo. So there's a cancer within a tattoo and I'll remove it. And under the microscope, I'm looking for the cancer to make sure it's all gone. I will see the tattoo pigment under the microscope and I will see the body cells around it. You know, so like it's real, like in real time, your body is coming to that tattoo and it's like, hey, what's going on? You know, now thankfully, most modern tattooing works very, very well. And I have nothing against tattoos. I think it's a great way to express yourself. I got my first tattoo myself not too long ago, after many, many years of being scared to put something permanent on my body. But it's definitely a great form of expression. You know, it just has to be done in the right setting, of course, and 100%. With the right sterility.
So for those of us who really aren't familiar with the term, can you elaborate a little bit on what Mohs surgery is or what exactly that entices?
Yeah, so Mohs surgery is actually, people think it's an acronym. Mohs is man. So this was a doctor, his name was Frederick Mohs. In the 30s and 40s, he developed this technique to very precisely and accurately remove skin cancer from delicate areas of the body. Back in the day, what they used to do, like let's say you had a skin cancer here. They would say, okay, here's a skin cancer. Let's take a big piece around it and take it out, and then we'll know that we got it all because we took a big piece.
Right.
Now, in areas of your body like your back and your stomach, that's fine. You have extra room, right? But if this is on your lip or your nose or your eyelid, you don't want to do that. You want to only remove the cancer if you can and leave behind everything that's normal.
Yeah.
So Frederick Mohs came up with a way to remove a very small piece of tissue around where the cancer is and test it in real time while the patient's waiting so we can see, did we get all the cancer or not? And the best analogy that I like to use, my fellowship director, Dr. Samani, taught me. So imagine a Reese's peanut butter cup, the chocolate, okay? In Mohs, what we do is we take out a very tiny Reese's peanut butter cup. That's what we're taking out. That's where the cancer is. The cancer is the chocolate.
Yeah.
What I'm concerned about is the wrapper. So I take the Reese's cup to the lab, and in the lab, I take the wrapper off and I flatten the wrapper. And then I look at the wrapper under the microscope. And I'm looking to see, is there any chocolate left attached to the wrapper? Chocolate being the cancer. If there's still chocolate left attached to the wrapper, that means back in the patient, wherever the cancer is, there's still cancer left over.
Yeah.
But sometimes the beauty of Mohs is you don't have to go back and take a whole nother piece, because under the microscope, you see exactly where on the wrapper the chocolate is. So sometimes it's only on one edge. And so then you go back and you take a small piece on one edge, right? Sometimes it's only on the bottom of the wrapper. So you go back and you take just a little deeper piece.
Right.
And in that way, you're very precisely and accurately removing skin cancer while leaving all the normal tissue behind and giving someone the highest possible cure rate for skin cancer. So Mohs surgery has a cure rate of 98% for most squamous and basal cell carcinomas. That's pretty close to the highest cure rate you can get in medicine for most problems. And that to me was like one of the major things that I was like, wow, this is an amazing thing that we can offer patients for these problems in these areas, you know, a cancer like that. So that's how Mohs surgery works.
So a lot of people are struggling, like from, what's the difference between like a dry skin and eczema?
You know, it exists on a spectrum. Dry skin to eczema, they're kind of related very closely. Some people genetically in their skin, they have defects in certain proteins that make their skin more dry, right? Now, some people, that dryness and those defects get to a point where there's lots of inflammation and a rash and eczema starts to form in the skin. So they're related, right? And so just like a lot of things in life, they're on a spectrum. Some people just have dry skin. So like, you ever see the rough bumps on the arms, you know, or the little dryness on the elbows? Yeah. Some people are just dry like that. Some people, the genetic defects in their skin are more severe. And so this barrier that we were talking about is wide open. And when it's wide open, stuff gets inside. And when that stuff gets inside, the security guards are like, hey, bunch of stuff in here. And then all of the inflammation comes to the area and it creates eczema or a dermatitis, or what's commonly known as atopic dermatitis. Yeah. So that's why in eczema or dry skin, one of the mainstays, the most important things is you have to moisturize your skin.
Yeah.
You have to take this, put the mortar back on so you can seal it up. And that's like one of the first things any dermatologist will tell you. If you have eczema or dry skin, you got to moisturize as much as possible, especially in the winter. Air is dry.
Yeah.
It makes you even more dry and irritated. Moisturization is key. So they're related. They're very related.
So the lotion's like kind of the cement between the bricking.
Exactly. Perfectly said. It's the mortar between the keratinocytes or your skin cells.
Right.
So like, there's like common skincare brands, that have various names. One of the names of the proteins that is used, or one of the kind of mortars that's used in your body, is called a ceramide. So ceramides are the mortar that link in between your bricks, the keratinocytes of your body, and keep things out. Yeah, so moisturization is key.
So this question, it's really important because it happened with me.
Okay.
What the bacteria in your gut?
Yeah.
Big shout out to Ahmed Anani, Dr.
yeah, he was
Ahmed.
telling me about this.
Yes,
Yeah.
I talked to you about it. Why, like the bacteria in your stomach, like let's say Candida or any another bacteria, affect your skin? So before, like I have dry spot way here in my foot, and I tried a lot of lotions, everything, and never went away. And then I did podcast with Dr. Ahmed Danani, and I showed him. He looked at it. He said, "Teef, it's not like skin problem." How you know, bro? It's in my skin. He said, "I think you have Candida, bacteria in my stomach. What does that has to do with my skin?" And then he let me do a test. I did the test, and it comes out I have Candida in my gut. And then he gave me nutrition medicine.
Yeah.
I took it, it went away.
That's awesome. I would say Dr. Anani is an astute dermatologist, honestly, because when it comes to being a dermatologist, the skin is the gateway into the rest of your body. When you see someone's skin or a problem on someone's skin, you can sometimes tell that there's something in their body that's not going right? Like Dr. Anani saw with your gut. The gut microbiome is so important, and so much new research is being done to kind of inform us what's happening in your gut, the things that are living inside of your gut, and the normal, what we call the microbiota, the normal flora of your gut that normally keeps things functional and leveled. It can be disrupted by a lot of different things, and that can affect all kinds of things in your body, including your skin. And the funny thing is, the second area where there's a lot of research being done in microbiomes or bacteria living in places on the body is the skin. So there have been studies done in eczema, like we're talking about, that if you don't have the right mix of bacteria on your skin, your eczema will be worse, right? So now there are studies done where instead of putting creams like Vaseline and stuff on your skin, they're putting bacteria lotions on your skin to rebalance the microbiome of
What it's lacking.
Exactly. This is new research. It's developing, but this is what's coming to the forefront, So what's going on in your gut and on the surface of your skin in terms of the levels of all these different bacteria, they are important. And Candida is a very common organism that lives in our, gastrointestinal tract, but sometimes it overgrows. And if it does, it can cause problems.
Yes. Who's overgrown?
One of the first places you'll see it from a dermatologic standpoint is in the corners of the mouth, something called angular cheilitis. A lot of the times people get Candida growing in their mouth, and that Candida will start to lay in these corners where there's moisture and kind of like wetness sticking together in the corners of your mouth.
Yeah.
And that will grow Candida. And that's where Candida likes to grow, in places that are dark and moist and there's friction, right, and wetness. So it's very astute. And those things, they can make your skin so much better. And we take a lot of things nowadays that can change your gut microbiome. Unfortunately and fortunately, there's a lot of supplements available in the world now, right?
Yes.
If you flip through Instagram, you'll find like 1,000 supplements that you can take. And everyone's trying different types of supplements, right? I don't know what the effects of that are on your gut microbiome, because we used to go from like eating a very rich natural diet,
Yeah.
raw organics, right?
Exactly.
To now we're taking supplements, we're taking different types of stuff, taking antibiotics for different types of things, and that's all changing the microbiome in your gut, and that could definitely affect your skin in different ways. As a matter of fact, there's one specific disease in dermatology called dermatitis herpetiformis, but it's actually a form of celiac disease. So if you have celiac disease where you can't digest gluten, or you have trouble with gliadin, one of the proteins in gluten, it will manifest in your skin as a rash in certain areas because your body is acting against that protein in your gut, and those same receptors in your gut that cause the inflammation that your body reacts to, they're also found in your skin. So you'll get trouble in both areas. So the gut and the skin are very interrelated, just like the gut and the brain are.
Yeah.
The gut-brain axis. Like when you get really scared, where's the first place you feel it?
Your stomach.
In your gut.
The whole saying, trust your gut.
Exactly. Where's the second place in the body? There's nerves. The most nerves in the body. The second place, your gut. Brain's number one, gut's number two. That's why you feel, they say trust your gut.
Yeah.
Do you feel it in your gut? That's because these two things are related.
The receptors are going off.
Exactly. When people are anxious, right? Their stomach, their bowel movements, everything starts to change.
Oh yeah.
Because what's going on up here really affects down here, right? And what's going on in here and here can then affect here, right? So subhanAllah, the body is a beautiful machine and everything was designed to be interrelated, and we're just starting to peel back the layers with research and science about how to connect all these things in the best way. So yeah, that's amazing. And I love to hear stories like that, honestly.
So how many treatments are there for, I mean, in your line of work, there's probably countless, things you're running into. Is there like a handful of treatments that just solve everything, or is everything case by case?
Yeah, for sure.
Yeah.
So any dermatologist watching this will laugh, but an overwhelming majority of the stuff that we treat in dermatology is solved by very few medicines. But before I talk about those, it's important to know that in dermatology, a lot of the times, any rash that comes up on your body, what you're really trying to get the skin to do is calm down, right?
Right.
Something happened to your skin, and now your body is riled up, right? The security guards, they're like, oh my God, what's happening?
Freaking out.
Right, and then inflammation comes to the area, and so your skin gets red and itchy and irritated and inflamed and swollen. And so our job is to get the skin, okay, calm down, relax, it's gonna be okay, right? And so we do that a majority of the time using topical steroids. So topical steroids are one of the workhorses, the mainstays in dermatology that you put on your skin when it's irritated or inflamed, and it calms things down.
Right.
It takes the inflammation away, the redness and the swelling, and the itch in a lot of situations. So topical steroids are like one of the mainstays in dermatology for like treating an overwhelming majority of conditions. Yeah.
Nice.
What's one skincare people should to have?
I love this question, honestly, because as you guys know, I'm sure, flipping through any social media, one of the biggest industries or markets out there in the world is skincare.
Right.
It's a multi-billion-dollar industry worldwide, and there is so much stuff that you could potentially try to put on your skin. But what do we know for sure? We know that the number one thing that ages your skin is the sun. And I know this when I look under the microscope when I'm doing surgery. When I do surgery on really young people, which unfortunately sometimes even if you're young, you can still get skin cancer. I look at their dermis, the second layer of their skin. It's where all your collagen is, your elastin, all of those things that make your skin plump and young. Those, in very old people, when I look at that same dermis, that dermis is gone. It looks like a wasteland. Instead of it being nice and pink, it's blue and gray.
Wow.
And all the collagen's broken down, the elastin's broken down. It's something called solar elastosis. Over time, as sun hits your skin, hits your collagen, your elastin, it breaks them down. And that breakdown of collagen and elastin in those fibers in your dermis, that's the number one thing that ages your skin. So when it comes to skincare regimen, the foundation of any skincare regimen, in my opinion, should be sunscreen, right? Always. And what is a better way to prove it than looking at your own body, right? So this gets tons of sun, right? because you're outside, you're walking. This doesn't.
Yes.
Go talk to anyone that's 50 or 60 years old and just have them flip their forearm, right? On this side of their forearm, you'll see little brown spots and stuff and scaly spot, right? Flip their forearm, it's nice, smooth,
Nothing.
white skin, right? Like when they say smooth as a baby's bottom, right? Why do they say that? Babies' bottoms are smooth, but also babies' bottoms haven't seen a lot of sun.
Right.
And so there's no damage there, you know? And so that is one of the major things to do in a skincare routine. Protect your skin from the sun every day. It's like investing, right? Like in your field, right? You get a mortgage, you're investing in the future, right? You're investing in the equity in your home, whatever you're buying. With sunscreen, it's the same thing, right? You're not gonna see right away you put sunscreen on and then like, wow, I look amazing, right?
Yeah.
Over time, protecting yourself from the sun is gonna keep you from aging faster and faster, right, over time. So that's number one. And then the second thing that's probably the most important skincare, medication to use is something called a retinoid or a retinol.
You guys heard that?
Yep, a retinoid or a retinol. So if you got sunscreen and you got a retinoid or a retinol, you're pretty set. You don't need 10 skin steps, routine. You don't need 1,000 things. You don't need to spend thousands of dollars. Go see your board certified dermatologist, tell them you want to start a skincare regimen, have them pick out a sunscreen that's good for your skin type and tone, and have them start you on a retinoid or a retinol that you're going to use at night to help maintain your collagen and keep your skin proliferating in the right way. And it's going to be fantastic.
Touching on collagen, something like you see it all over Instagram and TikTok, wherever it may be. I think as of the last 3 to 4 years, it's become really popular. Is a lot of collagen protein drinks that I see at GNC or Vitamin Shop, and I feel like everybody's taking collagen a lot more lately. Would you recommend adding collagen to your supplements, or is it a myth?
So I get this question from lots of people. My own mother has asked me this question. There is some data to show that if you take collagen supplementation, it can have improvements on your skin. But when it comes to supplementing your skin, I always ask my patients, what's your goal?
Right.
What are you trying to achieve? And then I will tell you if what you're doing is going to help you.
Exactly.
Right? Because some people come to me and they have a goal in mind and they think that, something that I can do is going to help them. It's not. Like one of the most common things in dermatology that you see is people come to us and they're like, can you put filler in and just
like you're a plastic surgeon?
You know what I mean? And I'm like, I'm sorry, I cannot.
Yeah.
It doesn't matter how much I put in. I'm not going to be able to lift your face.
Give you a new
into
jawline.
Early 2000s.
Yeah.
It's not going to happen. And so with collagen, it's the same way. Are there some studies that show that supplementation can be beneficial? Yes. Is it going to be a drastic change to your overall skin? In my opinion, no, and I don't recommend it for that reason.
For sure.
Yeah.
How can people protect the skin in the winter time, not in the summertime?
In the winter time, one of the most important things is moisturization. You get so dry in the winter, and that dryness leads to so many issues. Moisturization is key. Whatever moisturizer that you will use is the one that I recommend. Most men don't moisturize as a baseline, right? It's just not something that we're used to doing, right, growing up. And most men in general, honestly, they don't really take care of their skin that much.
Yeah, I use the same soap bar that I use for...
right? Right? So, but really, like joking aside, it's true. We have that kind of cavalier approach to our skin. And to be frank, before I became a dermatologist, I had the same approach.
Yeah.
I didn't really think about my skin that much, right? But your skin is it's your best foot forward. It's your introductory into the world, right? So you want to take care of it as best as you can.
For sure.
In the winter, when it's dry, when your lips are chapped, when all this stuff is going on, when the snow is hitting your face, and here in Michigan, the hail is hitting your face, right? You want to protect your skin. So moisturization with a good thick moisturizer, right? Something that is a thick cream daily on your face, okay? Chapstick, around your lips to prevent any chapping from happening, and even Vaseline in the inside of your nose, in the mucosa, where it can get really, really dry, especially in that winter air. It can cause nosebleeds and things like that.
Oh, yeah.
You got to keep those areas moisturized so that your skin can stay healthy. Like, that's the support you need in the winter.
What about the face oil? Is it good or bad?
You know, face oils, a lot of people use different face oils, and I think that the only one that I usually would recommend, that I know that some of my African American patients with eczema trouble and dry skin use a lot of coconut oil. And coconut oil, I think, works really well and has good evidence for support in dry skin. A lot of other oils are used, but the evidence base is not so tremendous. And so I don't like to get into the weeds about like those various oils on the skin.
So I had a question about melanoma in general.
Yeah.
Explain a little bit what melanoma is, and then a little bit of how you would treat melanoma, because I do hear it's a lot more common than, you know, the average person hears about, but I feel like it's a lot of unknown if you're not a dermatologist, for instance, but I would think it would be a great piece to just educate a lot of us on.
Yeah, no, absolutely. So melanoma is a dangerous form of skin cancer that forms in the top layer of your skin, the epidermis. In that layer, at the bottom, there are cells called melanocytes. They're the cells that make pigment in your skin. So they give your skin its color. Those cells can sometimes become cancerous. When they become cancerous, they can be very aggressive, and that is what a melanoma comes from. Those melanocytes in the epidermis of your skin.
Right.
The problem with melanoma is that a lot of the times melanoma is asymptomatic, means you don't even know it's there.
Yeah.
I can't tell you how many times I've had, speaking of men not really caring about their skin, I can't tell you how many times I've had girlfriends, mothers, sisters bring in the male in their life and be like, I want you to look at the spot on his back or his shoulder or his, and it turns out to be a melanoma. Because guys, right, we're like, it doesn't bother me. I'm not gonna bother it.
If it ain't broken,
like,
yeah.
Like it's fine, right? And the problem with melanoma is melanoma usually, it doesn't itch, it doesn't bleed until it gets really, really late. It doesn't cause you any trouble. It's just a little brown or black spot that looks a little weird on the skin. And it takes a trained dermatologist using either their eyes or a dermatoscope to be able to be like, hey, this is an at-risk lesion and it should be biopsied. So melanoma is a scary type of skin cancer.
Right.
But if caught early, if you're doing your normal skin checks, if you're paying attention to the stuff on your skin that's changing, it doesn't have to be. And if caught early, especially now with the amazing things that's happening in immunotherapy in medicine, melanoma is a treatable disease.
So what are like the histological differences you look for when you actually diagnose melanoma?
So histologically, when you're looking at melanoma under the microscope, there's some nuances, right? So the melanoma cells themselves, they will kind of clump into what we call nests. They'll do something called pagetosis. So they'll start spreading where they're not supposed to be in the epidermis. So they're supposed to stay at the bottom. They'll start moving up to the top. They can start diving deeper down into the dermis. So how it looks histologically under the microscope is it looks like an asymmetric, bizarre collection of melanocytes that aren't where they're supposed to be.
Right.
And on your skin, it kind of looks the same way. So there is a very common mnemonic used to help people look for melanoma on their skin. It's called the ABCDEs of melanoma, okay? It's like the alphabet. A stands for asymmetry. If a spot looks like this and it's symmetrical, it's probably fine. If a spot loses its symmetry and starts to look like this, you should get it checked out. That's A. B is border. If something has a nice, smooth, round border, it's probably fine. If the lesion border starts to become jagged or change in that way, get it checked out. C is color. Most moles, if they're normal, should be one color. If a mole starts to take on several colors, black and brown and white and blue, that is a warning sign. You need to get it checked out.
Yeah.
D and E are diameter and then evolution. If something is thicker or wider than the diameter of an eraser tip, usually we say, traditionally, it should be checked out. E is the most important one. Any one of these changes is something to come get looked at.
Okay.
Right? And so whenever you're in the shower or hanging out, or if you have a spouse, have them look at your back. If there's something that didn't used to be there or looks different, have it get checked out. Even if it's something that you're not sure whether or not it's there, our eyes and our brain are used to looking at patterns, right? If you're noticing something and you're not sure if it's been there, you should get it checked out, because more than likely it wasn't there.
Yeah.
Because our bodies or our brains and our eyes, they zone out information that's always present, right? Like if you see something you've seen 1,000 times, you kind of stop seeing it.
Yeah.
Right? And if it were to change, that's when you notice.
Right.
Right? So those are the things to look out for when it comes to melanoma.
What about this? It's really important, and I hate it.
I'm excited.
What about the makeup?
Cure the things you hate.
It's for girls.
Okay.
The one they make wearing a lot of makeup.
Okay.
And I hate makeup.
Okay.
So is it makeup long term gonna affect the skincare?
So I think that's a great question. If you're using the right kind of makeup, no. There is makeup that is very harmful to the skin because it kind of chokes your skin out. It's what we call comedogenic. It causes acne, it causes breakouts, it causes issues. So using makeup consistently is not bad at all, and there's no long-term effects as long as you're using the right kind of makeup. So
Please say yes.
I'm telling you, man.
Our
Say
lives
it's
are
not
rolling.
so-
I gotta tell it like it is. I gotta go with the evidence. Good quality makeup that's non-comedogenic and is made with good chemicals and good ingredients is not harmful long-term for your skin.
Okay.
It's not. Yeah, but it has to be good stuff.
Yeah.
It has to be good stuff.
But
I'm telling you, it's bad. Don't worry. Because a lot of guys too, they struggling with it. Man, should I see that girl without a makeup?
You know what's funny? It's like a lot of guys don't like makeup, right?
I hate makeup.
A lot of guys don't like makeup. I don't like makeup really either, particularly, especially excess makeup.
Yeah.
You know? But I think it's like the same way that like a lot of girls don't like super buff guys.
Yeah, it's
But, like
preference.
all of us are like, bro, I gotta get jacked.
yeah, 100%.
You know what I mean?
100%.
It's like a perceptive thing.
Yeah.
You know
right.
what I mean? But it is
Some
true.
guys, they like makeup.
Yeah, I mean, here's the thing for sure. I think personally, my philosophy, the less you do to your skin,
Less is more.
the better it's gonna be.
Yeah.
Right? The better it's gonna be. And like that's my philosophy with like most of my skincare, most of my, in-office stuff. If there's something that is gonna do okay on its own, I'll let it be.
Yeah.
I know it's gonna do its own thing and it's gonna pass, And I think that goes true for anything you put on your skin or think about doing to your skin.
Yeah.
Yeah.
It's crazy you said that about because when my acne was bad when I was younger, Proactive,
Yeah.
I ended up being allergic to it.
Really?
So all of a sudden when I
I
put
did Proactive too. We should talk about that actually.
Oh, yeah.
We should talk about acne. Did you do Accutane?
nothing,
It just did it. It just went away.
like
right?
I just have scars now.
Yeah.
But obviously, as a kid, it's hard when you have acne in high school.
It's debilitating.
Yeah. And,
It sucks. Pizza face.
when I had a young kid, we were in line when I was like fresh out of football practice. And in high school, I mean, you're going through these hormone changes and everything. So you're developing your body's forming into what it's supposed to be.
Right.
So mix that with sweat and 2-a-days in football practice, like you're constantly just sweating all over your face. So I had bad acne as in high school. And I honestly, like nothing crushed self-confidence more than when a little kid looks at you and he looks at his mom and goes, what's wrong with his face? You know?
Man.
And I got over that as, you deal with it how you want to deal with it. But I did try a solution of Proactive. It used to be a big thing when I was younger, back in my day. And I actually was allergic to it.
Yeah.
So Proactive, I've seen friends that used it. It helped them and everything. But my skin just didn't handle whatever it was ingredients were in there. And it swelled me up even worse. I looked like I was like fresh, those skin peels when your face is really red.
yeah.
That's how like it made my face. And honestly, the less stuff I was using and went back to basics of like cocoa butter and just some bar of soap, that's when it just started doing its own thing. Now, granted, I feel like hormones play along with a lot of that, but if somebody's dealing with that, I mean, have you ever dealt with anyone who used Proactive at all?
I mean, I personally use Proactive.
Yeah.
So like I share a similar story to yours. when I was younger, I had terrible acne.
Yeah.
Terrible acne. It's funny because like I never mentioned that when I was applying to dermatology, like it wasn't part of my story.
Yeah.
But like I had terrible acne when I was younger. And my poor mom took me everywhere.
Yeah.
Everywhere. Doctors' offices left and right, dermatologists, blah, 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 blah. And like you, I tried Proactive and all the regimens, right? And nothing honestly really worked that much. It would get better and then worse. And then eventually, thankfully, I grew out of it.
Yeah.
Right. But during that time period, like I took tons of antibiotics. We were just talking about like doxycycline for like months and months on end. I used tons of stuff on my skin. It burns sometimes, you know, it's uncomfortable. You have like white, you know, cast on your skin from some of the creams.
Yep.
It's so tough, right?
Yeah.
And especially if you're like one of the only kids, not that it's not common, acne is very common, but some people get it bad and I had it bad.
Yeah.
And it sounds like you did too.
Oh yeah.
It's really, really difficult. That's why honestly in my office, in my practice, if you come in and you've had acne and you've used doxycycline already once or twice, you've been on antibiotics, you've done all the things, you're going on Accutane.
Yeah.
You're going on Accutane right away. Accutane is a brand name for medicine that's called isotretinoin and is one of the, I think, single best medicines that we have to treat acne, especially severe acne, to prevent scarring, right? Because a lot of people, especially back in the day, some dermatologists were scared to use Accutane or isotretinoin because it does have side effects, but by and large, it's a very safe medication.
Right.
And it's going to prevent scarring and prevent like issues down the line. So if you come to me and you have bad acne and have had it for a while and you know you're ready, you're going on Accutane, 100%.
Yeah.
Like let's prevent the scarring. Let's get you back to like glowing, clear skin and
Big
just
time.
get you back to your confidence.
Yeah.
You don't feel yourself.
Yeah, and I think it's a lot of people undervalue how that is as a teenager, you know, with person with kids, or even remembering how we were growing up. You know, bullying happens sometimes, and you know, nothing could destroy your confidence more than what everybody sees when they first look at you. You know, it's your face, and it was just one of those memories where it's like, you know, I hated going through it, but I look back and obviously, like, you just got to figure out what works, but you know, I feel like a lot of people go through that. A lot of kids probably go through that, and you know, it could cause a lot of mental different like reactions. You know, people don't want to go outside more. They don't want to mingle with people more. They're just not confident with themselves. So it's good, you know, for Accutane to be something that's out there to you know, provide solutions for that for anyone who's listening to, you know, their kids or you know, friends going through it. You know, there's solutions to look into.
100%. There's a specific point I want to mention based on what you said. The depressed mood and the mental stress that people go through when they have bad acne is very real.
Oh yeah.
Especially in young children and in adolescence, in the formative years of life where they're growing and mixing and mingling and interacting with their peers, it's so crucial.
Oh yeah.
And there's a very important myth that needs to be dispelled every time I talk to a patient about Accutane. A long time ago, Accutane got linked to the side effect of suicidality and depression. Okay? Multiple studies have been done. Multiple studies have been done that show that that is not the case. In fact, multiple studies have shown that when you start Accutane or isotretinoin, most people get relief from their depressive symptoms and an alleviation from mental stress or suicidation or thoughts of suicide, because their skin improves.
Right.
This is something very important, I think, for parents to hear, because you're scared. You don't want to, you know, put your child in a worse position, of course, by treating, you know, a potentially benign condition. But it's just not the case. And so I hope that everyone really takes that home, is that Accutane improves mental stress and depressive symptoms in people with acne.
Right.
So I want to add to Yusuf's question. You know, a lot of people, they struggling from dark under. How do you treat dark under eye circle?
So dark under eye circles are tough to treat because they happen for different reasons. In some people, it's because they have allergies and the veins under their eyes are swollen. And so it gives the appearance of kind of swollen, puffy eyes.
Like the bags.
The bags, yep. And a lot of eczema patients go through that. In some people, it is loss of volume or fat in this area. As we age, the fat in our face kind of drops.
Yeah.
And when the fat drops from this tear trough area, it can sometimes cause a shadowing or a hollowing effect. right? And in other people, it's genetic. There's some genetic hyperpigmentation that can occur in these areas. And so it all depends on each individual person, what their, trouble is with the dark under eyes. But one of the most, I think, beneficial treatments that have come across for that in recent years has been peels and laser devices. So chemical peels, when done right in this area, can dramatically change the quality and the pigmentation, the texture of the skin in the immediate lower eyelid. And laser devices as well can very dramatically resurface these areas to create a tremendous change in the quality, tone, and texture of the skin. Other things too have been shown to be very beneficial, like PRP injections under the eyes, microneedling when done safely and appropriately under the eyes mixed with PRP injections can be stimulatory as well to kind of replace and replenish collagen under the eye and volume. And then some people, if they have a lot of volume loss under the eye, will get filler injected in these areas to kind of decrease the shadowing effect that's sometimes seen in people. But it's a very dangerous place to inject, and you should only go to a board-certified dermatologist who is an experienced and trusted injector, because filler and those types of injections do have risks.
Yeah.
And those risks need to be handled appropriately. But to answer your question, many things, but peels, laser devices, microneedling, PRP, those tend to be the best remedies for dark under eye circles. There are creams that do work too. Hydroquinone is a very common ingredient that works around this area. Hydroquinone mixed with a lot of different pigmentation remedies. Azelaic acid is one of them, and a myriad of things that you will find in the market. Those in combination with the devices and the treatments tend to work pretty well.
So is it you see the couple doctors, they use the laser to burn all that skin, the top of the skin.
Yep.
Is it gonna make your skin better, like build a new skin?
That's exactly what it's intended to do. Yeah. So many years ago, this technique for fractionated laser ablation came out. So taking the lasers that you're talking about and making a bunch of very tiny little holes in the skin. These little holes are called microthermal zones. They're these small injuries. They occur in like little cones all over the skin. And what they do is they stimulate the healing in the skin all over like a big net to create new collagen, new elastic fibers, and new skin that essentially rejuvenates and resurfaces your face. So they do work. They're very effective. There's a lot of new devices on the market that work very well for that, for acne scarring as well. And so it does work. The downtime from the procedure, like how long you need to take off afterwards, depends on the type of treatment you're getting and the laser. Usually you're gonna be pretty swollen and red in the beginning, and then you'll start to peel. So you'll get like this brown peeling that'll happen in the treatment zone. And then usually at the end of the first week, depending on what you're getting done, you start to look kind of like more quote unquote normal. But a lot of the lasers nowadays, have pretty quick turnaround and downtimes, and they're done very well. The important thing to realize is that it's not a one-time deal. A lot of these laser devices and these treatments are intended to be done in repeated intervals over time to continue the stimulation of the new collagen and the rejuvenation of your skin. Much like sunscreen is an investment, when it comes to that type of cosmetic skincare, it's an investment too. And doing it repeatedly over time only like compound interest. It only compounds, the benefit that you're gonna get.
For sure.
Yeah. As a barber, okay, because I think about this a lot, and when I'm doing surgery, I'm always trying to be mindful of how I'm standing, right? Because you're on your feet all day and you're working, right, with your hands. And so ergonomics, the way you're standing and moving, becomes really important. I was always curious, like as a barber, how do you approach the way you're positioning and moving to like make sure that like, you're protecting yourself and you're staying safe? Like, are there things that you do to help you with how you work, how you're moving?
Yes. So
Usually with scissors wise, you gotta keep your like arms straight. And when you cut in, that way you're not gonna affect your shoulder. I mean, I've been doing it. And when you do beard, most of the barbers, they go down and they line up,
they hunch over.
It's gonna give you a lot of effect in your neck and your back. I usually stand straight.
Yeah.
I learned that from a barber. He taught me. Like as soon as I started learning being a barber, he said, let the client get hurt, but don't get hurt. He gonna get hurt like 5 minutes.
Exactly.
But you gonna keep doing it all day.
Exactly. Yeah.
So move him the position you want, but don't move yourself. Like don't go down, just lift his head up. It's gonna take you 2 minutes to shave his beard.
Yeah.
Scissors wise, same thing. Move his head to the side, that way you're gonna be comfortable.
That's so true. It's so funny how related the two things are. Like everyone's a doctor of something, right?
Yeah.
You know, everyone's a surgeon of their own craft, but they're so relatable, right? My attending surgeons that taught me how to do surgery initially told me the same exact thing. Put the patient where you need them to be, because you do this every day, all day. And if you get hurt, you can't help people, right?
100%.
If they're uncomfortable for a little bit, that's okay.
Small period of time.
That's okay, exactly. And so you being in the right position is so important. And so I'm glad to see that you're being mindful of that, because that was such a big thing for me when I started, especially seeing like my dad. My dad's been a dentist for many years.
Yeah.
And in dentistry, they're always, you know, there's
Slouched
a lot of bending and movement, and it can take a toll on your neck and back. And so you have to be mindful of like the way you're positioning yourself, you know? The other thing I wanted to ask you, so like in surgery, I love all my little tools, right? Like I'm always looking like for a better scissor, like a better forceps, you know what I mean?
I love that.
I'm always looking for like just the better instrument to do what I want to do.
Right.
And I'm always thinking about, could we design an instrument to do this or that? In your craft as a barber, like how important are the instruments you're using? I assume that they must be the quality and the feel of the scissor and the size and like it all like matters, right? And are you always buying new stuff? Are you looking for different stuff?
So I usually like my toys, which is the so I have many clippers.
Yeah.
But I usually use just the
Your trusty ones.
yes.
Yeah. The trusty clippers. Yeah.
I buy a lot of new ones, but these clippers, it's perfect for me.
Yeah.
And I always barbers, why you don't change them? Bro, look, I have them.
Yeah.
But they don't cut like how these cut.
Yeah. If it ain't broke, don't fix it. Right?
No, I buy same brand like all the time.
Yeah.
But same brand, I don't change the clippers. I have different clippers, but I don't change them.
Yeah.
I just keep continual same that brand because I feel really comfortable when
your
I
hand,
cut. Yes,
right? Yeah.
they heavy. Barbers, they usually don't. I'm not saying I'm muscular, but I like how the model they have. Yes.
Yeah.
So I don't know. Give me like better.
No, it's the same thing. Like my surgical instruments, my needle drivers that I use, my forceps, I picked them specifically because I'm so used to them, the way they fit in my hand.
Yeah.
I don't even think about them. They're just an extension of my fingers.
Yeah.
You know, like I feel like they're part of me.
100%.
Like I feel less myself when they're not in my hands.
Yeah.
You know, because of how much you do what you're doing.
right.
Because think about it, all day, 8, 9, 10 hours a day, you got this thing in your hand and you're moving with it, right? Becomes a part of you.
Yeah.
And when someone gives you something different, you're like, this isn't me. You know what I mean?
I'm sure there's a tool to make it simpler to do a fade with one little like trimmer on there that would fade it automatically. But I feel like what he does, it's so meticulous.
It's
like
artistry.
It is art because being a client, like cutting with him for 7 years, I almost memorized exactly what he starts off with, what he does, and where it's gonna go, and every tool he uses on the way there. To where I'm like, bro, if God forbid Tief ever left to out of state or something for 3 months,
follow him.
I think I'm gonna know what to do if I got all his tools, because he's so meticulous with it, where it's a step-by-step process. And you would think, why doesn't he just use an easier machine? You will never get the quality he gets with his cuts with the 2 machines he uses from day one.
100%. That's why we pay so much for stuff that's done by hand.
Service.
Right? By hand,
Yes.
right? Like by hand, by your eyes, by your experience, right?
100%.
It's like a handcrafted coffee table.
100%.
Yes, it's going to cost a little bit more money.
Yeah.
But it's a quality, handcrafted, one-of-a-kind table. And to go back to his cuts, that's how it feels. Like some people, like they complain about service charges or people can't sell this for this price. in my industry, in your industry, in your industry, I mean, we're all in 2 or 3 separate fields, but at the end of the day, it's what makes our clients, our borrowers feel good.
Exactly.
You know what I'm saying?
Yeah. We were talking about this earlier, right? Like,
Yeah.
what connects all fields, right? And what connects everyone and what they do is that we provide a service to people, and the people need to feel like they're being heard and they trust you and they're having a genuine experience,
Yes.
right? So like when you come cut with teeth, like, yes, you know, you're getting the meticulous artistic haircut, but you're also getting his personality and his energy, you know, and the enthusiasm.
The vibe when you come in.
And his curiosity. And we were talking about this earlier, like communication with whoever you're interacting with is so key. And, you know, we were talking earlier about how like some of that today is lost.
Oh yeah.
Because of social media and all this stuff. And like this face-to-face is happening less and less.
Yeah, people are forgetting how to humanize with another person. They're forgetting how to even conversate with anybody nowadays. And, you know, depending on your line of work, 3 different worlds we're all in, we all relate to the human being in front of us on a really human level with empathy. We feel for them. I'm getting them a mortgage based on what their emotional goals are. You're cutting their hair based on how they emotionally want to feel, and you're fixing people because physically they're not confident, and you're trying to help them out.
Yeah.
So the key to all this is being a human to everybody. And I think to sum up a lot of the things we're talking about, that goes a long way. Being able to half the acronyms in the terminology you use in your field, I don't even know what half of it is. But at the end of the day, if I'm coming to you because I don't feel good in my skin, or if there's something I'm scared to talk to somebody about that I'm noticing, you know how to make it to where that patient in front of you is comfortable and confident walking out the door from talking to you, that they know what's going on, not just from what the book terms told you in school and med school.
100%.
You know, and that is a very, very skilled trait to have, you know, with cutting hair, dermatology, mortgage brokering, whatever it may be. I encourage a lot of people to go back to putting your phone down, putting your social media down, go have a conversation with somebody. We were talking about Ubers.
Yeah.
You go on vacation, speak to that Uber driver, speak to that person wherever you're visiting, you know, get a feel for how culture is outside.
Something.
Yeah. You get a lot of takeaways, you know, and humble pie is served best slice by slice.
Yep.
And you'll get real humble talking to a lot of people with their stories and hearing their come up. You know, everyone sees the successful person at the top, but a lot of people miss how they got there and what road they took, you know? So I love to speak to people. I love to talk. I love doing what I do because I'm figuring out everybody's story. And once I find an emotional attachment they have, that's what I sell you on. I don't sell you to make a commission. I don't sell you on just trying to get the loan closed. You're telling me what emotionally is most important to you: your haircuts, your face, your skin, your house, your dream home, you know, the American dream kind of thing. Mm-hmm. And that's what makes us all 3 successful at what we do. And I really think that if there's a takeaway to take from this side chat, it is getting back to the humanizing feel of we're all the same people at the end of the day, regardless how much money you make, regardless what you went to school for, what you're doing in your life. Being a human is the most important thing, and treating everybody that way is going to go way further in your life than just thinking you're...
It's funny, Doc, especially when I call him Yusuf, like, he's not my client. Like, I don't look at him as a client. Yeah. Like, I always put extra time in, like, when I book him, extra time, because I know we're going to talk a lot. Yeah. I mean, serious. Yeah. Like, good conversation. Like, some people, like, I feel good, like, I just give them time. Let me talk with them. Yeah. I feel good.
100%. Yeah, and that is, you know, I think an attribute that you have. You know your clientele and your people that you're serving so well that you know how to tailor your approach to them. You know, and this is something we were talking about earlier. You know, like alluding to what you were saying, when patients come into my office, my job is to treat them like you're saying, yes. like they're my mother, my sister, my brother, my cousin, right? You have to connect with people in that way, because all 3 things that we do, there's vulnerability.
Yes.
People are coming to you and they're vulnerable.
Oh yeah.
I want to buy a house. My wedding's coming up, right? I have a thing on my face. So like there's a vulnerability, and someone's coming to you and they're trusting you with that. And their hope in their heart is that you're going to treat them the way you would treat your own family members, right? You're going to do for them what you would do for your mom and your dad and your brother and your sister and your... And so all the students that rotate with me, all the residents that rotate with me, anybody that's ever in the operating room with me or, you know, in a surgery with me, I always tell them, this is not John Doe,
Yes.
right? The best way to be a doctor is whatever patient you're seeing, whoever they are, find someone in your life that is that person.
Yes.
Right? If you're seeing like a young kid in their 20s with acne, like maybe that's your brother.
Yeah.
Because you have a young brother, right? If you're seeing an older guy, you know, like that's your dad.
Yeah.
Make things relatable to your own life so that you can keep energizing your empathy.
Yes.
Because in all of our fields, and in mine especially as a doctor, you have to be empathetic all the time.
Yeah.
And a lot of doctors talk about kind of like burning out from empathy, right? Because it's hard.
Yeah.
For me, I do it every day, right? But for them, and this is what I always try to remember, this is your first time maybe
Yeah.
getting something cut off on your face, having this procedure done. And so that empathy, you need to refuel it from somewhere. Where do you refuel it from? As of right now, there's no supplement
Yeah.
yet, right? You can't take an empathy supplement yet. So you have to refuel it by mentally putting yourself in a perspective of like, who is this person to me? This is someone's family member, someone's loved one. And that puts you in the right mindset to do the best thing for them.
Yes. Because you're in a career. So like to you, they could look at you as, oh, you're just doing your job.
Exactly.
If 16-year-old Yusuf went into your office, I'm not thinking, oh, you're just treating this as a job. I'm looking at you like, hey, I'm dealing with this acne that's bothering me deeply as a kid. I want you to understand that, you know? I don't want you to just treat me as patient number 3, patient number 6.
Exactly.
And I feel like that's what makes you very successful at what you do, is you know how to connect with somebody at an empathetic level where you are being very relatable to them.
I would say, alhamdulillah, I got very lucky. Like they say in life, everything happens for a reason.
Yes.
I was a patient for a very long time myself when I was younger because of the surgery and those things. And you just reminded me of an interaction I had in a room with a doctor. And I'll never forget this because when it happened to me, I was like, you know, if I ever do become a doctor, I'm never going to do that. And I was probably in my mid-teens somewhere. And I was sitting on the exam table and I was having like some like heart poundings that I came in to see them for, you know? And we've all had those, you know, every now and then. But for me, because of my heart history, I was scared, you know? And so I went in and the doctor zipped in, you know, 2-3 minutes maybe. And then as he was leaving, I asked him a question and he like had his hand on the doorknob, you know? And like, I felt like I had already lost him.
Yeah.
To like the next thing.
Yep.
As I was talking to him. And I don't think he realized how much that affected me. But I was sitting there and I was like, man, you know, I'm never going to do that. And I always stay mindful that if I'm talking to a patient in a room, I stay engaged with the patient.
Yeah.
I'm not drifting away to the next thing. You're here because you're trusting me with your health.
Yeah.
I'm here to take everything that I know and everything I've experienced to help you with that.
Yeah.
And in that moment, it's me and you, right? And that's how I want you to feel, right? And it's hard. There's lots of patients. There's lots of clients.
Yeah,
the
you're
next
not
guy's
thinking
calling
subconsciously.
for the,
You're like,
you know,
you're
the
like
next lender's call. Like, there's lots of stuff going on. But you know what? That person is coming and they're trusting you. And when you give them that kind of attention and you treat them like one of your own, that's where it comes through.
It goes a long way. And I feel like it's really important because I visualized that doctor grabbing the doorknob right now while you're sitting there freaking out, not knowing.
I'm scared.
Yeah, you're really scared, and it's emotional. And for someone to just grab a knob and almost walk out the door, it kind of leaves that feeling of, am I just a number?
Yeah.
But versus a doctor like yourself that obviously you're more aware of that. I'm trusting you, and I actually feel like you are in it. You are listening to me. You're in it for my best interest. I want you to help me. Like,
exactly.
You know?
And now that I'm a doctor, I know that in his mind, he knew I was going to be okay.
Yeah, of course.
Like, he knows I'm going to be okay, but I don't know I'm going to be okay.
Yes.
You know? And that's your job as a doctor, that you take your knowledge of my okayness and you communicate it to me so that now I believe I'm going to be okay.
Yes.
Right? Because I don't know what you know. I haven't seen what you've seen. I don't have the experience you have.
Yeah.
Right? And so you have to be there for them.
For sure. Like,
you have to be there.
We talked about my brother-in-law. Like, that was shout out Dr. Amen, but him stressing to me, being able to talk to him outside, like I'm getting to talk to a doctor that's not actually I'm a patient for. And I get pick his brain, and he was telling me the same stuff you were priding yourself on, like being able to talk to somebody as another human being is so important. And especially when we're dealing with whatever it is we're dealing with in life, new house, new haircut, confidence, saving their skin, their look, you know, that's very important.
Doc, thank you for coming.
Thank you for having me,
Really
man.
appreciate you.
This is a great conversation.
Definitely.
Hey guys, make sure if you need anything or any help with your skin, make sure hit him up.
Shout out Dr. Abe.
What is your office?
Here for you guys. So we are located on Michigan Avenue in Dearborn between Telegraph and Gully, 24924 Michigan Avenue. If you guys need anything, you can find us on Instagram at derm_Detroit or derm_hacks. Let us know. We're always happy to help. And of course, if you're trying to look good, feel good, and do good, not only see me, but you gotta see Barber Teeth.
Barber Teeth, baby.
There we go.
You know who you're gonna hit up for a house?
Hey, shout
Best person.
out Rocket Mortgage, baby.
Let's go. I appreciate you, Habibi.
It was a pleasure,
Thank you,
my friend.
Yusuf.